بسم الله الرحمن الرحيم. محاضرة اليوم عن local anesthesia. The local anesthesia is the subject in dentistry, so we concentrated on it. The type of the topics that we discuss now is the armamentrum. The armamentrum means the instrument that and material that you use for giving a local anesthetic solution to the patient. There are three armamentrums for local anesthesia. The first one is dental syringe that have many types of dental syringe that give is involuntarily to the patient. The second one, the dental needles. There are needles for give injection of local anesthesia. And the last one is the local anesthetic cartridge, or call it carpools. This is the vehicle for carrying local anesthetic solution. Additional armamentrum, besides to that have giving in as injectable, we have topical antiseptic, topical anesthetic, applicator sticks, cotton gauze 2 by 2 inches, and hemostates that it is locally as a not injectable type of local anesthesia. We start from the dental syringe. We have many types of dental syringe. Its name is dental, used only for a dental clinic, not used in medical apparatus. So هذا احنا لما نسمي هذا أداة as a dental, not a syringe, not ordinary syringe that used by the physician or sub physician مثل الممرضين والممرضات الذين يعطون injection by normal syringe, but it is a dental syringe. The first type of dental syringe is breech-loading metallic cartridge type aspirating. This type of aspirating syringe that can aspirate the fluid from inside the body by its presence of hook in the top of the piston. This type of syringe is very safe that giving for block anesthesia. Second type, breech-loading metallic cartridge type, non-aspirating. We have no hooks at the end of the piston, so we cannot aspirate a fluid by ordinary way. So it is used infiltration is more than in block. But if there are not present, we can do aspirating for non-aspirating type. Other type, breech-loading plastic cartridge type aspirating. We use a metallic type, but it is a plastic type. We cannot sterilize it by heat, only sterilize it by the chemical solution as antiseptic, and it is used only for only one patient. So it is again aspirate the fluid, but it is not sterilized by heat application. Other type, breech-loading metallic cartridge type, self-aspirating. This is a complex syringe that have by itself can aspirate a fluid from it, but need a high pressure, so that it is expensive and not used in dental clinic very widely. A pressure syringe. If there are cannot give and local anesthesia by ordinary syringe, we use a pressure syringe that have give a certain amount of pressure to push the solution. So you control it by dentist to give a high pressure on the certain area, mainly in the periodontal ligament that need a high pressure that have not lead to blockage of cartilage within the syringe. Jet injector, it is the only syringe not need a needle. It is a topical anesthesia by push the fluid through the syringe and put it on the mucosa and not have any injectable use for it. It's used as a topical anesthesia. The last type is disposable syringe. Disposable dental syringe is not used very widely in the clinic, but in the arbitrary place. يعني في المناطق الريفية نحتاج أكثر من سرنج. هذا التعقيم يكون صعب، فنستعمل disposable syringe instead of metallic type. The safety of syringe. The syringe must be safe or have no high pressure that give is slightly injection of local anesthesia inside the tissue. Mainly we use it as subgingivally or supraperiosteally type of injection, so it must be not have highly pressure, and it is safe to change the carpool from its syringe, and can easily move it and easily to sterilize it without any damage to the syringe. The American Dental Association criteria for acceptance of local anesthetic syringe include the following. They must be durable and able to withstand repeated sterilization without damage. They should be capable of accepting a wide variety of the cartilage and needles. They should be permit repeated use. They should be inexpensive, self-contained, lightweight, and simple to use with one hand. They should provide for effective aspiration and constructed so that blood may be easily observed in the cartilage. So we have as windows within the syringe that can see if any fluid, not blood, pus, and saliva or other fluid within the body can see it when aspirate it. The parts of each loading metallic cartridge type aspirating syringe. This part is the first one at the beginning is needle adapter, where the needle is inserted on the syringe, and then the pills, that the body of the syringe, and inside the pill we have piston with harpoon. The harpoon is the side that aspirate the within the dental cartridge, and the piston that push the local anesthetic solution within the cartridge. And the other part is the ring grip, that the ring that have surround this area of the syringe. And the last part, the thumb ring that push the piston within the thumb. This is the part of it. I repeat it: needle adapter, the pearls, the piston and harpoon, ring grip, and thumb ring, that it is all the part of the aspirating syringe. And we have windows at the side, one window or two windows at the side of the pearls. This figures shows again the aspirating type dental syringe, the dental tip and that I call it a threaded tip, and the harpoon and the piston within the pearl, and the ring grip and thumb ring. That diagram shows part of the dental aspirating type syringe. The advantage of aspirating type are visible cartilage, aspiration with one hand, autoclavable, rest resistant, long lasting with a proper maintenance is the main advantage of aspirating dental syringe. The disadvantages are heavy weight. حقيقة هي ليست بالهيفي وجود الهاربون، بس تعتبر مقارنة من aspirating أكثر وزن من عندها، فلهذا يعتبر heavy weight. Maybe too big size for small operator. هذا أيضا مسألة نسبية. حقيقة هي وجود الهاربون ما راح يزود من حجم السرنج، بس يعتبر slightly larger than the non-aspirating type. Possibility of infection with improper care. حقيقة care of cleaning the aspirating dental syringe is very careful and must clean it, and the harbon must clean it thoroughly with a brush and put it in autoclave for sterilization, or it may the possibility of infection may be from one patient to other patient transmission. The second type is breech-loading metallic cartilage type non-aspirating syringe. This is not harbon at the end of piston, but all part is the same. First part needle adapter, the harbon said is the piston, but without harbon, the pedal without harbon, and the ring grip and thumb ring. How we do aspiration with non-aspirating dental syringe. A slight amount of aspiration may be achieved as follows. Slight pressure on the piston produces a bulge in the rubber plunger, which in turn exerts pressure on the solution in the cartilage. Release of this produces suction. If the needle tip is an in blood vessel, a thin spiral of blood which rapidly diffuses will be seen in the solution. حقيقة ضغطة بسيطة على الثumb ring تدفع local solution من خلال needle, and then pull your thumb to be negative feedback pressure that enter if there are any fluid within the needle end. But if there are no any fluid, the air must enter through the needle and go to the cardboard. The pressure syringe we use in a very dense bone or the palatal side of the palate, but give high pressure. The advantages are measured dose, overcome tissue resistance, cartilage protected, non-tethering in new device. حقيقة أنا أقيس كمية الكارتليج، فلهذا أعطيها قد أحتاج هي ربع نص كارفولة أثبتها، وتقاوم resistant to any hard tissue, and protect if there are high pressure, protect the cartilage from damage, and it is non-threatening. The disadvantages are cost, easy to inject too rapidly, threatening original device. حقيقة very costly than dental syringe normal مكلفة، فلهذا لا تستعمل في أغلبية عيادات أطباء الأسنان. وكذلك easy to inject too rapidly في حالة إنه measure of pressure is not measured correctly, that have a rapid injectable. The injector حقيقة used as a topical local anesthesia for small area in the mucosa that have carried the local anesthetic solution from the cartilage to the mucosa of the mouth. Advantage: does not require use of a needle. Deliver very small volume of local anesthetic solution. Use in topical anesthesia. حقيقة لا استعمل سبراي or gel راح تنتشر مع اللعاب في منطقة واسعة in the oral cavity. فلهذا إذا وصلت إلى soft palate راح البيشن يحس gagging, and if it's swallow that a simple amount that lead to have GIT trouble, that lead to stomach and gastric irritation of the mucosa. لهذا تعتبر هذه كمية كلش قليلة فقط in the mucosa that give a local solution. حقيقة استعمالها as a topical anesthesia is not have needle insert on the syringe. The disadvantage of the This type of syringe inadequate for pulpal or regional block. Some patients are disturbed by jet injection costly may damage periodontal tissue. في حالة إن وجود periodontitis and severe damage to the periodontal ligament فراح تؤدينا إلى أنه this topical anesthesia lead to damage of the periodontal ligament. It is not beneficial for certain patient. حقيقة أكو حالة نفسية إنه إذا ماكو نيدل فبتعتبر syringe لهذا النيدل وكلش مهمة للحالات النفسية. It is costly for the dentist to take it. How to care and handling the dental syringe. The recommendation concerning care of syringe as following. After each use, thoroughly wash and rinse the syringe free of any local anesthetic solution, saliva, or other foreign matters. Autoclave the syringe in the same manner as other surgical instruments. تعتبر الدنتال metallic dental syringe هي أحد أدوات الجراحة، فلهذا تعقيمها حال أي آلة جراحة by autoclave. After every 5 autoclaving, dismantle the syringe and light lubricate all threaded joint and where the piston contact the thumb ring and the guide bearing. حقيقة إنه نسوي lubrication by oil كل المناطق اللي بيها تمفصل in the syringe وخاصة ويا البستون and ويا thumb ring that have that movable. So when put an oil that have easily used to open and close it. Clean the harpoon with a brush after each use. And finally, also the harpoon is designed for long term. حقيقة aspirating type يجب استعمال الهاربون من matte material and the shape is stay for long time of using of the dental syringe. The clinical problem. Each instrument used have certain clinical problem. The first one, leakage during injection. When reloading a syringe with a second local anesthetic cartridge and a needle already in place, one should be sure that the needle penetrates the center of the rubber diaphragms. An off-center perforation will produce and avoid puncture of the diaphragm that permit leakage of the anesthetic solution around the outside of the metal needle and into patient mouth. حقيقة عند استعمال السكند كارتريج أو كاربول يجب أن نضعها في مكانها الصحيح وإلا lead to injury, lead to damage of the diaphragm and go the local anesthetic solution outside of the cartridge. Second problem, broken cartilage. A badly worn syringe may damage the cartridge, leading to breakage. This can result from a bent needle at its proximal end and may not perforate the diaphragm on the cartridge. Positive pressure on the thumb ring increase inter-cartridge pressure, which can cause cartridges to break. حقيقة في حالة إنه النيدل كانت ما مثقوبة أو معقوفة أو ما داخلة بالدايفرام فراح يصير ضغط شديد على الكارتريج فلهذا تؤدي إلى أنه broken it by this pressure. So when any resistant to the give anesthesia, you must sure that needle is not bent, not blockage, and that needle is enter within the diaphragm to have easily go the local anesthetic solution or then the needle to the tissue body. The second part of the instrumental or armentum is the dental needle. The dental needle is not as ordinary needle used in medicine. It consists from the beginning. The first part is the bubble as to injectable part that enter to the tissue, and then the shank. This is cylindrical in shape, narrowing and opening in the side of the shank, and is connected by hub to the syringe adapter, and the last end is the syringe penetrating end that go through the diaphragm to have the release the solution of local anesthesia through the needle to the body tissue. The type of dental needle is according to the gauge, is that have the long or short gauge. The long is about 35 and short is about 25 millimeter. The short used for infiltration only, the long used for infiltration and block technique or other technique that can use by dental syringe. The The gauge and the length. The gauge is have small diameter and the large diameter. The small diameter is about use is less than common in large diameter. So in the market we have a large diameter and long needle is for giving in both type of local anesthesia. How we care and handling needle must never be used on more than one patient. حقيقة احنا نستعمل disposable في أخذ in metallic type, the stainless steel type of needle. We can sterilize by autoclave, but it is difficult to inside the needle to clean it very carefully. So use disposable type of needle that use for one use only for one patient. Needle should be changed after 3 or 4 tissue penetration in the same patient. في حالة تحتاج أكثر من 3 to 4 injection فلهذا يجب أن نغير النيدل لأن راح يكون needle blend فلهذا يكون painful when injectable. Needle should be covered with a protective sheet when not be using. حقيقة يوجد نهايتين للنيدل that needing within the shank as a sheet within protective to the shank and sheet protect the penetrating end, the syringe penetrating end. على مود نحفظ على البيشنت yourself and the assistant for no any penetration by injectable by this the part of the shank and the syringe penetrating in. Needle must be properly disposed of after use. حقيقة يجب رمي هذه في أماكن خاصة من حاويات النفاية ليست في حاويات النفاية الاعتيادية لأنه injectable after return protective sheet from both sides and can dispose of it to not be used a second time. The clinical problem of needles. Dental needles have pain on insertion. The use of dull needle can lead to pain on initial penetration of the mucosa. This may be avoided by using sharp new disposable needles and application of topical anesthesia at the penetrating site. حقيقة إذا كانت dull needle هذه استعمالها يكون painful لأنه راح يسوي tear to the mucosa. بس إذا كانت نستعمل disposable with sharp bubble هاي راح تعطينا nice anesthesia. وإذا استعملنا a topical anesthesia that in the site of injection تقلل البين. The breakage. Bending weaken needle making them more likely to break on subsequent contact with hard tissue such as bone. Never attempt to force a needle against resistance. Smaller gauge needle are more likely to break than larger gauge needle. حقيقة كل ما يكون قطر النيدل قليل كل ما يكون سهولة كسرها في حالة أنه hint the bone very strongly. فلهذا يجب أن نستعمل the needle is carefully and do not hint the bone to be no any blockage لأنه في حالة كسر النيدل راح يسوي لنا مشاكل كثيرة وصعوبة إخراج النيدل from the tissue of the body. Pain on withdrawal. Pain on withdrawal is more likely that they occur when the needle tip forcefully contact as a hard surface as bone. Therefore, a needle should never be forced against resistance. حقيقة البين on withdrawal هو after inject the needle so that have to is highly forced that penetrate the bone or any hard tissue that need to have or injecting subperiosteally or within the bone that leads severe pain. Injury to the patient or administrator. A major cause is carelessness at initiation by administrators although sudden unexpected movement by the patient is also frequent causes. The needle should remain kept until it's used and should be made safe immediately after withdrawal from the mouth. حقيقة يجب الحذر عند استعمال النيدل dental needle أن تؤدي إلى injury to the upper lip, lower lip, and to the leg, to the cheek, to the any soft tissue of the gingiva. هذه في حالة إنه كان carelessness الطبيب الأسنان راح تؤدي إلى this problem. The last part of the armamentarium that used for local anesthesia is the cartilage, or call it carpool. The parts of the cartilage is from beginning to the end, the diaphragm that is surrounded by the latex-free enclosure and the gold color cup and the syringe, glasses syringe that form the body of the dental cartilage, and the last thing is the stopper, that is free stopper, to be maintained the local anesthetic solution within the carpool. The cartridge contains, the solution contained within the dental cartridge are local anesthetic drug. The drug or drugs contained within the cartridge are listed by their present concentration. The number of milligram of the agent can be calculated by multiplying the percent concentration. Example, 2% equally to 20 milligram per mil. So the 1.8 mil cartridge of 2% solution contains 36 milligram. This is the local anesthetic drug and must be written on the glass of the type of its local anesthetic drug within the glass of the cartridge. A second part, a vasopressor drug is included in some anesthetic cartridge to increase the safety and the duration of action of local anesthesia. Cartridge contain vasopressor also contain chemicals that serve as an antioxidant most frequently used in sodium bisulfate. The vasoconstrictor is very important for a local anesthetic solution because it leads to have safety and long duration of action of local anesthetic drug. Other part is sodium chloride is added to content of the cartridge to make the solution isotonic with the tissue of the body. أهم شيء بالlocal anesthetic solution بما وجود vasopressor vasoconstrictor يؤدي إلى acidity، فلهذا راح يكون أكثر isotonic وجود sodium chloride in the body. Distal water is used as dilute to provide the volume of solution in the cartridge. This can carry by distal water to be have in as injectable of local anesthetic solution. Care and handling of cartridge. Cartridge should be stored at room temperature. Cartridge should be not used after their expiry date. Cartridge should be listed by their percent concentration. حقيقة الكارتريج كلش مهمة تحفظ في درجة حرارة الغرفة وليست في الثلاجة أو في المجمدة، لأنه في حالة انجمادها راح تسوي لنا مشاكل عديدة باستعمال local anesthetic solution. The date of expire that written on the glass of the cartridge is very important. Have not give any expire local anesthetic solution, and listed by percent concentration. كلها موجودة listed within the cartridge, so it's concentration of local anesthetic drug on vasopressor or another part of that have put within the local anesthetic solution. The clinical problem of the cartridge. Bubble in the cartridge. A small bubble of approximately 1 to 2 millimeter diameter will frequently be found in the dental cartridge. It's composed of nitrogen gas which was bubbled into the local anesthetic solution during manufacture to prevent oxygen from being trapped in the cartridge and potentially destroying the vasopressor. A large bubble which may be present with the plunge that is extruded beyond the rim of the cartridge. is the result of reasoning of the anesthetic solution. Such cartilage should not be used since sterility of the solution cannot be assured. حقيقة في حالة إنه توضع الكارتج في الثلاجة فريز أو الريفرجريتر راح تتجمد عند ذوبانها راح ترك لنا bubble of nitrogen. This is to have is expire cartridge. أو في حالة استعمال الحرارة راح تصير تفاعلات بين أجزاء اللوكال anesthetic solution وتؤدي إلى إنه formation of bubble that it is nitrogen bubble. Second problem, extruded stopper. The stopper can be extruded when a cartridge is frozen and the liquid inside expands. In this case, the solution can no longer be considered sterile and should not be used for injection. Frozen cartridge can be identified by presence of large air bubble more than 2 mm by the extruded stopper. An extruded stopper without bubble is indicative of prolonged storage in chemical disinfectant solution and diffusion of solution into the cartridge. حقيقة في حالة إنه local solution is froze that have the water increase its size that lead to have not broken the glass tube, but the stopper be extruded for outside that it is expired. Burning on injection. A burning sensation on injection of anesthetic solution may be the result of one of the following. We have two causes for burning of anesthetic solution. In normal response, first, the normal response to pH of the drug. The pH of the dental cartridge containing vasopressor is lower than 3.3 to 4 than that without vasopressor is 5.5 to 6. So the plain anesthesia have somewhat more rapid onset of clinical action and more comfortable. In addition to an inclusion of sodium bisulfate as antioxidant into anesthetic solution to prevent the biodegradation of the vasopressor by oxygen which might be present in the cartridge during manufacture or which can diffuse through the semi-permeable diaphragm after sealing. Reacts with oxygen before the oxygen can destroy the vasopressor. This have very important to be within the pH of body, not reduced to be acid than in alkaline. That pH of body is 7.4 or 7.6. The cartridge containing sterilization solution. The use of the sterilization solution that effect on the stopper or diaphragm that have lead to an entering of a sterile solution within the body and lead to have that increase burning on injection. Overheat cartridge that lead to have a bubble that if frozen cartridge that put on the flame directly and lead to overheat cartridge. Cartridge containing a vasopressor, this lead to acidity and this not work within the pH of the body. Leakage during injection that lead to have an injection damage to the diaphragm that have go outside of local anesthetic solution. Broken cartridge if high pressure on the cartridge that not benefit for it and lead to a broken cartridge. How preparation of the armamentarium, how we can use the dental syringe, needle, and the cartridge. First, we open the syringe by using the thumb ring and the ring, finger ring, and after pulling the piston outside of the barrel, and insert the cartridge within the barrel, and it stop within the end of its syringe, and close it, and then put a needle within the center of the diaphragm and throw it until we have is very careful and very strong is attached to the dental needle adapter of the syringe, and can use it and you can remove it in opposite direction. This figure shows the syringe dental metallic aspirating type of syringe with needles. Thank you for your listening a lecture.